Then we go to another unit. Yeah, then we go to another unit. I didn't put a picture here. So that's basically happens in the mouth. But truly, this illness, it is big, like a belong kind of fungi infections. It not only happens in the mouth, it possibly happens in other parts of the body. But if it happens in the mouth, then they got illness. So that's we say, especially happens in the mouth area. That's we give the name, thrush. But it truly possible happens in other parts for the infant, especially for new babies. So firstly, let's say what means oral thrush. So that's the Chinese name. 河口窗，口 is mouth. Yeah. So something happens in the mouth, kind of like infection in there. So basically, typically symptoms for this one is a small white color kind of cover on the membranes of the oral mucosa. They can happen inside the mouth, sometimes on back of the throat area, and also can happen on the tongue, inside of cheeks area, or back of the throat area. So something in the infant's mouth, white color, they can like form a big part, or they make a separate few parts, like on the tongue. So that's basically we're talking about is fungi infection. Fungus, including two types. One type is yeast. Yeah, one type is yeast. So if we're talking about yeast infection, you're right. You're right. So that's generally say fungi infection. We say our body we have normal flora, like some balance between bacteria and fungi. For adults, our body totally development. So for adults, it's not that easy cause fungi or yeast infection. But for babies, they are pretty easily happen because their body not totally built up yet. So kind of a balance not totally formed yet. So that's pretty common illness, especially for new babies. So they are not especially happens for the time of the year. Anytime, yeah, anytime. And mainly happens in newborn babies, yeah, newborn infants. But also happens like little bit older infants and children. If they have some body deficiency kind of condition, yeah, weakness, deficiency, that pretty easily got infected, including fungi infections. So that's basically, and also some children, they have chronic problems, chronic illness. Then their body is deficient. Like children always got bacterial infection, and then they use antibiotics for some time. Then, like losing the balance, no more flora, means between the bacteria and the fungi. So they possible cause these illness, fungi infection, and also we talk about last illness, diarrhea, still possible. So that's some reasons cause the problem. So for TCM, yeah, we always talking about Western medicine first, then we talking about TCM. TCM etiology, yeah, TCM etiology. So that's basically for TCM, we're thinking about that some heat accumulation. Or maybe heat toxins. So for TCM, infection kind of illness belong to heat toxins. So sometimes, yeah, sometimes even they are in the uterus, they still possible cause the infections for the fetus. Like the mom get a severe kind of infection kind of illness. And after delivery, yeah, after delivery, so some hydrogen is more important part, especially when illness happens in the mouth. If no hydrogen for the mouth, that still can cause the problems. Or even sometimes, yeah, even sometimes, some contaminations to the hand, to the feeding, and maybe for the feeding requirements, like the bottle feeding for the babies, or even the nipples of the moms got some dirty, not hydrated, so that's dirty easily cause the problem. So for the patterns, yeah, for the pattern, for TCM category, yeah, TCM category, we mainly thinking about the heart and the spleen, heart and the spleen. When we thinking about heart, because our heart open to the tongue, yeah, heart open to the tongue. So that problems pretty commonly happens on the superficial of the tongue. So even like we talking about some ulcers happen in the tongue, that we still thinking about heart issue, maybe heart failure. So that's relationship with the heart. And the mouth relationship with the spleen. So mouth problems, that with the relationship openly with spleen. And also spleen channels go to the tongue. Spleen channel truly go to the tongue. So that's also even tongue problems. We still can thinking about spleen disorder in there. So that's basically this disorder. We're thinking about some heat and maybe heat toxins. So that kind of heat toxins go to the heart and the spleen. And then some heat rising up, then cause the problem. So that mainly happens in the mouth and the tongue. Don't confusing these illness with tongue coating. Tongue coating usually for infants, like a white coating, like white coating. They will go all over the tongue, all over the tongue body. Generally, geographic kind of tongue coating is not that common for the case. And also, it is more sticky. It is more sticky. And also, don't like the food, like after drink the milk, maybe some like milk pieces in some part of the tongue, but pretty easily removed. Like give the baby some water, it will be disappeared. But this one is white color and greasy and pretty hard to remove. And could be multiple places. Yeah, could be multiple places. And thick and thick. So that's truly some difference here. It's not a tongue coating problem. Then we're talking about the different pattern and the treatment. So we say mainly pattern. Yeah, mainly pattern, heat in the heart and the spleen. That we talking about already. So heart open to the tongue, spleen open to the mouth. So tongue and the mouth problem. We're thinking about that the heart and the spleen problems. But generally, when we talk about the heat, usually we talk about maybe red color for the tongue body, maybe yellow color for the tongue coating. But this one, still white color. Yeah, still white color. Maybe little bit yellow, but mainly is white color. Yeah, white color. And the patches cover the mouth, yeah, oral cavity, and cover the tongue. It's depending. Yeah, it's depending. From the beginning, maybe this small part, and gradually they got to pretty bigger part. And then we can see some mucosa membranes kind of more red, and then red face. So that's we talking about heat condition, even red lips. And the heat makes the infant irritability. So that's the local symptom. Generally heat symptoms, yeah, or generally other symptoms could be fever, yeah, could be fever. And the infants will be cry, yeah, they feel uncomfortable in the mouth. Sometimes it's painful, sometimes it's painful. Especially painful when eating food, make it more painful. Then they will don't want to eat. They will cry. So that's generally. And the inside mouth is dry. And they're thirsty because heat inside. But when they try to drink something, still painful inside the mouth. Then dark yellow urination, yeah, dark yellow urination, internal heat, and dry stool, internal heat. So thus the pattern is excessive internal heat pattern. So tongue is red tongue body and thick yellow coating that's still heat. But the cover part covered coating. The pulse mostly liquid and rapid, kind of heat combination with some dampness. Finger ring, purple color. And stagnate, yes, stagnate, means look like not moving that smoothly, but generally say is pupil in it. So treatment principle, clear heart heat and clear heat from the spleen. So that's the means drain damage, but generally clear heat both heart and the spleen. So basically this kind of condition, we can thinking use combination local points with distal points together. So here is 3 pair of the points here. So one point is located locally, another point is distally. We do each of the group points one day, and then we follow the orders. And third day we go to third pair. So basically, we did like this kind of circle to do it. So the first pair local points we go to ren 23. We know when we needle ren 23, direction go to root of tongue. So that's truly pretty good points treat tongue problems. And hard 6. Hard 6 is C collect points of the heart we call EC. Yeah. That's truly we can use for clear heat. So that's the first pair. Yeah, first pair. Then second day, we use the points stomach 5. Stomach 5. Still close to the mouth. Yeah, close to the mouth area. As local points. With stomach 36. Stomach 36 is 25 points. We're talking about incidents have these problems. They must have some underlying body defects in it. So we use stomach 36, 25. Then the third day we use the third pair, stomach 7 and LFO. Stomach 7 still local points close to the mouth. Yeah, close to the mouth. LFO distant points, common points for the head, including head orifice problems. We can go to them. So once every day, yeah, once every day. And then we follow the circle here. If still not recovered, we still can go back to the first one, first step. So that's generally say we treat this pattern. Then we're talking about the second pattern. The second pattern is a defensive kind of heat rising up pattern. So still heat pattern, yeah, still heat pattern. Still have white color patches on the mouth or maybe on the tongue in the oral cavity, or maybe just feel like a scarlet pattern. Yeah. Sometimes it's the whole pattern cover. Sometimes it's a scarlet pattern cover. And also maybe surrounded with some dryness. Yeah. But maybe not. Maybe not. And generally speaking, we say patient generally weakness. Yeah, generally weakness. So that's the pattern symptoms here. Emaciation. Yeah, emaciation. Body weaker. Constitution weaker. And generally weaker. Yeah, you look the baby look like a smaller and weaker and a slow development, like some baby can speak already. So that baby still couldn't speak. Some baby at the age can walking already. He still couldn't walk. So that's generally weakness. And the pale color, yeah, pale face, and some heat rushing up, red cheeks, and the 5 center heat indifference, dry mouth, heat damage body fluid. But because it is deficiency kind of heat, they damage body fluid, but they don't want to drink. Tongue is red without coating, that's indifferency kind of tongue. Pulse is threaded, that's weaker or deficiency kind of pulse. Finger vein may be pupil. With a pupil color in the finger vein, it is still heat. So heat cells plus deficiency cells, thus deficiency heat rushing up. So treatment principle, we can say nourishing in and subduing yang and open the orifice or unblocking the orifice. So we still follow pretty similar pattern, similar like points there. We still have local points. Then 23, stomach 5, stomach 7 there. And we still have distal points. Yeah, distal. But these distal points, we need more tonify, or nourishing. And we still can use LS4 common points for the face. Certainly, you can add in more nourishing or tonify points here, like the spin 6, 3.6. So that's for this part. That's for this part. So basically for TCM, we just have these two patterns. Yeah, just have these two patterns. One pattern is excessive heat. Excessive heat. That's excessive heat in the heart and the spleen. Another one is different heat. This heat rushing up. So generally for TCM, we only have these two patterns. as commonly parted. Then we're talking about a little bit more for Western medicine kind of treatment. So generally speaking, that's the local problems mainly. Local infections happens in the mouth is the local problem. So that's truly we can use some medications or drugs like locally. So basically, we can use some medication to just put inside the mouth, and that's generally working pretty well. And severe case, we can use another kind of medication, and we still put locally, like 3 to 4 times daily. So that truly can kill the yeast or fungi in there, but not damage the mucosa in the mouth cavity. So that's basically from Western medicine perspective, we can have some medication truly we can use. And also, some vitamins can help also. Vitamin B12, vitamin B12. So generally speaking, like some mouth ulcers or tongue ulcers, you still can use vitamin B12. That's help. And also vitamin C. Vitamin C can help the self-healing. But vitamins not truly kill the fungi. So if we try to kill fungi, we still need some drugs. But with the vitamins, the body recover or cells recover faster. So that's some Western medicine aspect. Then we're talking about prevention. Then we're talking about prevention. So prevention, we need to start from people got pregnancy. When they got pregnancy. So we say when the mom's immunity system stronger, their baby's immunity system will be stronger. So now we're talking about give the baby all the nutrition. That means the mom eating any kind of nutrition. So it must be hygiene. Hygiene. So that's basically avoids some special kind of food. Maybe can generate some heat, like more greasy food, more greasy food, and more spicy food or pungent food. That can generate some heat. So truly, heat is not that good for the pregnancy mom. And also, we're talking about these kind of fungi infections. Not only happens in the mouth, truly for new infants, it mostly happens in the mouth, but truly possible for the adult. If the mom have the infection in the vagina area, so that's the baby delivery passing the route. So pretty possible cause new babies fungi infection or yeast infection. So basically, if the mom have these problems, like some itchiness in the vagina area, and maybe some white yellow discharging coming out, and also if we're looking locally, still similar white patch cover local area. So that's truly same yeast infection. Got treatment immediately before the baby delivery. So basically, can just use local. Yeah, we have a lot of medication or drugs we talked about before. Yeah, put on the local and then we'll kill the yeast or fungi. Don't waiting for baby delivery. Truly, when baby delivery, if the problem not be treated and pretty easily cause the baby infection. So that's for the pregnancy mom. Yeah, pregnancy mom. Mom's healthy, baby's healthy. And also for infants, keep the mouth clear. Keep the mouth clear. So that problem mainly happens in the infant's mouth. So we need always keep the mouth clear. And also be careful. Need clear for the mom's nipple because the baby eating, drinking the milk, breastfeeding and eating, and touching the nipple area. If not area not clear, pretty easily cause infant infection. So we say yeast or fungi belong to normal flora of the people. So they normally everywhere over the adult skin, but they are not cause illness because they have some balance in there, but not for the infant. Infant's body is not that stronger yet. So if contaminated by these kind of fungi, they are pretty easily cause the infections. So including the nipples, including the bottle used to feed the babies, and the other stuff, and the other stuff, whatever you use for the babies, need totally clear or sterilized. Yeah, totally clear or sterilized. So that's basically everything directly touching to the mouth is pretty possible cause infection. And also try to prevent some injury in the mouth mucosa. So that means be careful of the food. Yeah, still be careful of the food. Not too hard, not too hard, yeah, not too hot, not too hot. So that may be damage inside the mouth mucosa. And if they damage the mouth cavity mucosa, and then easily got yeast infection because our skin, our mucosa, still kind of protection for our body. And also, yeah, try not always scratching the mouth, scratching for the mouth. I think for the adults, sometimes they pretty like scratching for the tongue. And especially when they go to see TCM practitioners, they know like each time we're always looking for the tongue. And some patients, they don't understand it. They think about, oh, so greasy tongue coating, so yellow coating is not good looking. So I meet some patients, before they come in for the treatment, they brushing their tongue. Yeah, they brushing the tongue, then they come in. And later on, I tell them, don't brush your tongue before you go to treatment. So truly, we need looking for the tongue, especially for the coating of the tongue. Then we know what happens inside the body. If they brushing their tongue, just like on the face, they make some makeup there. So we couldn't truly find what's the natural color of the face. So we couldn't truly find what's the natural color of the tongue coating. So that's pretty common. But for the babies, sometimes thinking about the mom, thinking about the clothes, like a clear for the mouth, try to scrub in the mouth. But if too hard, still damage the mucosa of the mouth. And feeding the babies, yeah, feeding the babies with more nutrition. Then we're talking about the nursing care. Then we're talking about nursing care. So nursing care mainly, yeah, nursing care mainly keep the food balance, yeah, keep the food balance, and enough nutrition, and enough fluid. So we're talking about not overeating, but we still need enough nutrition, and we still need enough like food to eat, but not overeating, yeah, not overeating. And if the feed the babies is breastfeed babies, certainly we need clear. Certainly we need clear. And generally say we can just use warm water. Just use warm water. And also after feed baby, after baby eating the milk, and can use some warm water, and then kind of swallow in there, kind of clear for the mouth cavity. So that's after like the breastfeeding for the milk, that kind of clear. So that's basically the way we pay attention for the mouth hydrogen, yeah, oral hydrogen. And we still need to look in any change in the baby, yeah, any condition. So like for the baby, I believe some of them may have baby already. So if they cry, they will cry, but sometimes for no reason they cry. You need to watch it. You need to watch it. So mostly the baby cry, they will have reasons. And the different sounds of the cry will be different. So like the mom for a long term from the baby cry, they know the baby how the pig or baby is hungry. or baby feel cold or even feel hot. They have different sounds of crying. So if you notice some crying look like no reasons in there, they may be sick. Yeah, they may be sick. Then you need looking carefully. So differ like a different part of the baby's body, including the mouth part. Yeah, including the mouth part. To try to find if something wrong. So baby's problems. Uh, we talking about the infants. Yes, small baby. They couldn't tell you. They couldn't tell you. They just cry. One symptom is cry. Another symptom, they don't want to eat. That's usually they have sick. So looking especially inside the mouth to see if some changing in there, some white color of parting in there. So that's maybe just this year. So that's pretty commonly situation when babies just cry, don't want to eat. Yeah, that's they are sick. That's their languages. Yeah, that's baby's languages. That's it. And then checking, especially inside the mouth. So that's basically. So generally speaking, this kind of situation is not that severe. If we treat immediately, if we treat immediately. But truly severe case, yes, severe case, like they blocking, like inside the soft air, like blocking the voice box area, make the air passing the route pretty narrow there. That's still pretty severe kind of condition. So that kind of condition still immediately getting treated with both PCM and Western medicine, animal medicine. So that's basically we say these problems is not that severe kind of problem, but truly sometimes they still possible got pretty severe kind of condition.